I
I, Zachariah A. Kasim,
swear by the Almighty God
swear by Almighty God
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter in issue
touching the matter and issue
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
So help me God.
So help me God.
Thank you very much. Could you introduce yourself to the committee, please?
Good afternoon, Chair, Madam Chair. My name is Dr. John Eko Otu, and I'm the Regional Director of Health Service for the Savana Regional Health Directorate of the Ghana Health Service. Yes, Honorable, it's me, John Eko Otu, the one you know.
Zachariah A. Kasim, the District Director of Health Services, East Gonja Municipal Health Directorate.
Thank you very much. Your first infraction is on paragraph 1387, and it's talking about 12,000 Ghana cedis of unaccounted payments. What has happened to this amount?
Thank you, Honorable. The East Gonja Municipal Health Directorate has accounted for the 12,000, has paid the 12,032 Ghana cedis, and the documents have been duly shown to the auditors. Thank you.
Auditors, can you confirm, please?
Honorable Chair, the payment has been duly accounted for.
Great. Let's go to Municipal Hospital, Salaga, 1390. Honorable Benoit Seasa.
And there's an unearned salary of 76,000 Ghana cedis. It had to do with a Japan Tiwa charity, Ali Atimbela Samuel. Yes, I think these two people, they received an unearned salary. Well, I'm told the auditors cancelled. Can you give us an update as to whether it has been paid to government coffers as directed by the audit service?
Thank you, Honorable Chair. So, with respect to Madam Ejewati Wacha, the hospital provided him gave him permission to start the program whilst they worked towards getting approval for him to do the program. Unfortunately, the approval did not come. And again, just before the program started, COVID also started. So he basically worked throughout the program because the program was online and used his leave to write the exams. So we have evidence here showing that he was at work throughout the program.
So did you show this evidence or give this evidence to the Auditor General when they came over?
To the best of my knowledge, it was shown to the auditors.
Auditors, can you please speak to this so we make progress?
Honorable Chair, the status report that I have from the region does not indicate that they have cited the document. But if they have it, we can have a look at it.
Okay, so I think we can make progress on this. If what you say is what actually took place, please furnish them with the various documents so they validate and then we make progress. So once they validate, they can clear this person. But if they don't validate, the 69,000 will still be charged to Mr. Atimbela and he would have to pay. So please furnish them with the requested documents and let's clear him. Thank you.
Thank you very much.
You are discharged. Thank you.
Thank you.
Now we have Northeast Region, Chiriponi District. Those who haven't taken the oath, those standing outside, if you can come in so that, well, yeah, you take the oath, I think that'll be fine.
And those sitting there, if they need to speak.
And those.
Mr. taking the oath and speaking on the phone as well. Can you finish with that and then we can move on? Michael, I think they are ready now.
I
Dr. Kwabena Sapon,
swear by the Almighty God,
swear by the Almighty God,
shall be the truth,
shall be the truth,
the whole truth,
and
nothing but the truth.
nothing but the truth.
Wait, Chair Pani, introduce yourself to the committee, please.
My name is Dr. Kwabena Sapon. I'm the regional director, actually. The head of BMC will join us very soon.
I am Mahama Mawia, the internal auditor.
That's welcome. Letter, your information has to do with some expired drugs to the tune of over 1 million Ghana cedis. And of particular interest on the list is the first line item, beg my pronunciation, Lisinipro tablets. Lisinopro tablets. LisinopRPRIL. And that is almost 720,000 Ghana cedis. Sir, you are welcome. Is he going to answer questions? Then he needs to be sworn in, sir. Or he's been sworn in? You've not been sworn in? Okay.
I, Dr. Mahmoud Aliu Salama,
Swear by the Almighty God,
swear by the Almighty God
that the evidence I shall give before this committee,
that the evidence I shall give before this committee,
touching the matter and issue,
shall be the truth,
the whole truth,
and nothing but the truth.
So help me God.
So help me God.
Doc, welcome.
Thank you, Chair.
Yes, Doc. Doc, I was asking for what lisinopril is used for, tablets.
Okay. Thank you, Chair. Lisinopril is an antihypertensive. So it's used in the treatment of elevated blood pressure. Thank you.
Then it suggests to me that you have a lot of elevated hypertension in the region, because you have almost about 24,000 of this drug in stock, and about 30 of them No, 24,000, which has expired. And that is costing almost 720,000 Ghana cedis. That is 24,000 per whatever, a carton or so. That is quite expensive to have a lot of that in the constituency, 18,500. Why? Who does the stock management and the procurement and requisition for these?
Honorable Chairman, the drugs in question were not procured. They were donated items during the COVID era. We couldn't exhaust it before they got expired. There were times that we had almost a partial lockdown and total lockdown. So the OPD attendance reduced drastically. So that in essence amounted to we not able to exhaust it before the expiration. Thank you.
Auditors to dispose of these drugs?
Yes, please.
Have they all been disposed of?
Yes, please.
Okay. Auditors, can we confirm that these drugs have been disposed of such that it will not get to the mainstream prescription for people to have them consumed?
Honorable Chair, we can confirm that the distraction of the drugs was carried out on.
I was an NGO or a company donating drugs, and then I hear you say, oh, we did not buy resources to purchase those drugs. You understand? Going to get bad. You could have called the various regions. I have this stock, I have that stock. Do you need it? Do you need that? We all know that hypertension is one of the rising cases, non-communicable diseases in this country. So next, we did not buy it. It was donated to us. But let's make good use of it, because I know there are 1,001 people who cannot even purchase these drugs. So moving forward, let's guard jealously whoever donates medication or any other medical item to us, so that when they sit back and they watch how we're using it or the impact of it, they will be in a position to always support us with some of these things.
Okay, Chirpani, I guess that is all for you. Auditors, have they Mamprugu Health Center? Muaduri Health Directory, is it here? Are they here?
Yes, Honorable Chair. Unfortunately, they step out to find some snack for themselves.
Okay, let's move on.
But the regional director is there, and then
Vouchers?
Yes, please, Honorable.
You can?
Yes,
okay,
please.
then Honorable Day. Paragraph 1398.
This infraction has to do with unpresented payment voucher. There was a recommendation from the auditors that the district health director should recover and same be paid into the Auditor General's recoveries account at the Bank of Ghana, failing which the district health director should pay and represent.
Thank you, Honorable Chair. The recommendation has since been complied with, and the
Auditors, can you confirm payment?
Honorable Chair, they presented documents to the tune of 10,735.36, and then the actual payment was 4,066.
Could you figures again?
So what they did was they presented, for some, they presented the PVs to the tune of 10,735.34. And then they recovered an amount of 4,066. So it is not that they recovered the entire amount of 14,801. So part is for documents that were presented, and then we had cash that was paid.
Okay.
So the question is, at the time of audit, where were these documents?
At the time of the audit, unfortunately, there was a change of leadership. The then district director, who was in charge, took the PVs to make payment at the northern region from the northeast. If you know where Mampuru Mauduri is, it's a very far place. So after making the payment, I think he was on his way back and had an accident. So in fact, he was not able to, I don't know, he was not in himself at all. So finally, when the incident happened, we retrieved 3 of the PVs. And the 3 that we retrieved sum up to the 10,000 that my auditor is talking about. Those that we have seen were the one that was the 10,000. Those that we didn't see was the 4,000. So initially, we made a payment. The evidence are here. We made a payment 4,066 Ghana cedis. So when we submitted, it was rejected. That the recommendation is that the money be recovered, not the PVs be found. So my regional director has to press that they comply with the audit directive. Then we made a payment, 10,000 was paid. Unfortunately, the then director who made the payment didn't equally call Ghana cedis.
So,
this
so
payment
the bottom
has
line
since
is,
been paid.
it's been taken care of.
So this payment has been paid. Now everything is
you.
cleared. And the
Thank you.
evidences are here.
So there are a lot of people behind you. There are a lot of people behind you. All right. The next infraction is on paragraph 1401. And Honorable Cletus will take care of that one. 1401.
Thank you, Chairman. 1401 has to do with health insurance. Yeah, claims rejected. Can you speak to this?
Thank you, Honorable Chair. The NHIA's rejected claims is something that we are having very little control about. At times, it happens because of lack of the caliber of staff that we have to process that. But the recommendation the auditors ask is we need to seek clarification from the NHIS unit. And where we sit at the district level, we can only write a letter, route it through our regional director to Director General, and then to the NHIS. In fact, the evidence is also here. We have written, but yet to get any response to that effect.
Well, Chairman, the auditors, what I can say to this issue is that, you know, some of the scheme says that maybe you can attend to her twice. But if the person goes to hospital more than twice, then health insurance would deem it as like the person is abusing the system. But maybe medically, the person condition warranted that she should attend, hospital more than necessary in a month. So this is how these things came about. And sometimes they will also say overprescription and all of that. So we need to, I don't know how the auditors look at these things. So let's try to do some reconciliation there. Because present health insurance card, they must take it. You know, so that is how these things comes about.
Yeah, honorable member.
The claims, I understand what you are saying, but you see, some of these things too, it's not their fault too. It's not their, that's what I mean. They are asking that the money should be, collected back. How are they going to collect the money?
Honorable member, you see, what management responded to was, management responded that a vetting committee will be put in place to support the preparation of claims through the IT system to drastically reduce the rate of disputed claims at the facilities. Did you do that? I've asked him the question. Okay. Did you do that?
Yes, there is a vetting committee in place.
And did you prepare the claims through the ITs you normally do? You gave a response to the auditors.
Yeah, we did.
And I want to make sure that you follow through what you told the auditors.
We did.
And what came out of it?
We submit the claims through the LIM system, which is the light wave system. Yes, claim it. Yeah.
Subsequent audit will reveal whether indeed there is a committee in place and that an action has been taken on this matter. We are yet to carry out our next audit.
All right, thank you very much. Yours is Mampurugu. You are discharged.
Chairman, please, before they leave, Director General, or Regional Director, sorry, of Savana, the expiry date was 2023. COVID wasn't around in 2023. So please, and those who are here and are coming to sit here, that lie will not fly again. Because 2023, we didn't have strict COVID restrictions. Yet we had drugs that are needed by people. That director, let it not happen again. And the other regional directors, please, even if it means giving it to them for free, rather than allowing it to go bad, let's do it that way. Rather than allow drugs to the tune of almost 800,000 Ghana cedis to go bad, and come and sit here and tell us it was because of COVID restrictions in 2023. Please. Thank you.
Thank you very much.
You are discharged. Now, Northern Region, Regional Medical Stores, Tamale. Director General, and if they came all the way from Tamale, they should be close by. So that when we call them, we can try and then discharge them early. Have you guys taken the oath, please? All of you, okay. Introduce yourself to the committee, please.
Honorable, my name is Chrysanthus Kubio, Regional Director of Health Service, Northern Region.
Mr. Chairman, good afternoon. My name is Mohamed Yakubu, Deputy Director of Administration, Northern Region.
Mr. Chairman, my name is Dr. Inusa Adams, Medical Superintendent, Gushegu Municipal Hospital.
I think the first paragraph, paragraph 1405, it says outstanding debtors balance of 36.2 million. But this includes that of the Northeast region, the Northern region, the Savana region as well. So Savana, there's a balance of 7.46 million that you ought to collect. The Northern region, there's 18.6 million Ghana cedis that you ought to collect. And then the Northeast, 10.12 million Ghana cedis. And so we have, is it the Northern region we have sitting here with us?
Yes, Honorable.
Okay, so yours is 18.2 million. Tell us how you have been able to collect those debts from the various places that you supply drugs to.
Thank you, Honorable. We have been able to collect a total of 23 million.
Out of the 36 million, you have collected 23.
Yes, Honorable.
Good. Okay. So break it down for us.
Leaving a total of 13 million, about 13 million.
The total is 36. So if you've collected 23, it can be the difference can be 18 million.
13, 1-3.
Oh, you've collected 23,
Yes.
and we are left with 13 million. Oh, okay.
Yeah, Honorable.
Thank you. So can you break it down for us?
So
How much goes to Northeast, Northern region, and the Savannah?
The total. So for Northern region, we have collected a total of 15 million. Then the Savannah, 4.3 million.
Have you finished the auditors with these payments?
Yes, please.
Auditors, can you please confirm?
Honorable Chair, we are yet to have the status on this issue.
Oh,
Respectfully, you knew you were going to come here.
Honorable,
You were
we have a
supposed to have
document.
been here in August. Gentlemen, we don't do that here. You can't tell.
Sorry about that. Thank you.
Respectfully, next time, you have to give it to them for them to validate before we can discharge or we can take what you are saying. Currently, as we speak, we cannot sit here and say that you have indeed paid 23 million. So you go back, reconcile with them.
So
In terms of
thank you.
supplying medicines to the
We
various places.
have engaged the BMC heads, and we have also we ensure that we do the collections to reduce the indebtedness from the BMCs. We have also added it as part of their performance appraisals to ensure that the collections are done. Thank you.
And so when are you looking to deliver on the 13 million, the outstanding 13 million?
As at 21 billion. And I don't remember the figures from Northeast and Savannah, but they have also done some collections. We are doing it together. Thank you.
Yes, so when are you going to finish collecting the 13 million?
By the close of the year.
By close of the year. And so you have it down.
We'll try.
Okay. Thank you.
I'm not convinced. You said by the end of the year. Then later on you said we will try.
No, I will not take will try. I'll take the first one.
I added we will collect, but I added that because it's also dependent on the payments that they receive as facilities. This is the plan that we have put in place. And as and when they pay, we follow up and collect the monies and ensure that we are able to clear the debt. Thank you.
Later. Do you still supply drugs to these regions?
Yes, please.
So are these collections you're making now different from the current supplies that you are making to them? Are you segregating the supplies in terms of the current one and say this will match to the outstanding one in the 2024 report, but not to the current one in 2025?
So we ensure that they pay the debts previously owed, not the current bills, to ensure that we are able to clear that.
So it means that the current bills or the current drugs that you are supplying is not being paid. Because if you are receiving for the old one, it means you are still piling up. And it's just the same thing.
It is a continuous process. As you receive supplies, you also distribute to the facilities. to ensure that the drugs are available. So you pay and you collect.
Just let me end. So it means that by the end of the year, you will not have collected the money because you still have had the 2025 all in arrears.
Oh, it's a continuous process. It's a continuous process. That's
continuous process. But you don't pile up debt to the tune of 36 million and tell me it's a continuous process. You have to have a cutoff point at somewhere. It can't be a continuous process. There should be a cutoff point that beyond a debt of 5 million, I may not be able to supply you. These are the checks and balances that we put in place because it's public funds. And these are monies that the hospitals also need. I mean, those who supply the drugs also need to do other equally important things and always have enough stock for the hospital. So, Minister, I think you should look into this and get them a cutoff point beyond which they cannot pay unless you clear your debt. Because you cannot, just 3 regions alone, continuous process. You have to have a cutoff point. And that is how you can manage some of these things. Let's move to the Northern Regional Hospital, 1409, paragraph 1409, page 312, that you received from the Japanese government. You demolished a children's ward, which was renovated in April 2021. In 20 projects for improvement of health facilities elsewhere, other than breaking a renovated children's ward that had just been renovated in April 2021. Couldn't we have done that elsewhere?
The processes are in place.
Has it been reconstructed?
Not yet.
Not yet.
Not
okay,
yet.
So then please go ahead and answer my question. I thought it had been reconstructed, so you were gathering momentum to tell me that, Madam, it's been reconstructed.
The processes are in place to...
So if the processes are in place, why then do we demolish this one? So where do... have you created another makeshift ward for the children? What's happening?
Yes, please. A makeshift ward has been created for the children.
Why? In the northern region, the children's ward, they are hoping and waiting that they'll hear something positive that they demolished and.
I think the plan was in place for the construction to be done, but there were some delays in clearing the items at the port. And that caused a change in the value. So they had to revalue the whole project and to start with the construction. That was what caused the delay. But
the people of Ghana, how do we do this to ourselves? It is not you, but why do we do this to ourselves and how? Let's check some of these things because it's all public funds. It was renovated in 2021, in April 2021, and brought down in 2023 because we received funding. We said we claim one NGO or one, is going to put up another project at the very place that we can push through for the processes to be expedited and then construction of this children's ward starts as soon as possible. Thank you very much.
Thank you, Honorable.
Director, has the items been cleared from the port? Because you indicated that you were waiting for some tax waivers on the imported materials. What materials are these, and have they been cleared?
I don't have the details now, but it's a bilateral agreement between Ghana and the government of Japan. I will need to check to be sure of their records,
Sir.
so that I don't say anything.
Sir, the gentleman sitting beside you seems to be giving you information. So it means he has more information than you. Why wouldn't you answer it, sir?
Thank you, Mr. Chair. I think it's no different from what Engineer Director said. It's a bilateral agreement between government of Ghana and government of Japan, and it was like a support from the people of Japan. And the facility was instructed to go ahead and prepare the grounds. I think the facility has letters to that effect, just that the auditors were not satisfied with the evidence. Otherwise, the evidence was provided. Why was a wall we pulled down in the name of a facility that they were not very sure? No, I think they were very sure about it. Unfortunately, we don't have the control because it's a bilateral agreement between government of Ghana.
But to be honest with you, say, whether bilateral agreement or not, they never asked you to break down an existing facility to give way for clear the grounds. Couldn't you have used another piece of land somewhere? So the harm has already been done. Let's see how best we can support the minister and the team to make sure they expedite action on the processes. And once the processes are through, we can start the construction. We don't need to wait for a project that they were going to fund. That is not the case. So let's move on. But Minister, we'll press upon you to speak to your minister and the team to expedite action on this so that the processes can go through and the actual construction and begin for the children's ward. Thank you very much.
Thank you, Honorable.
Gushegu Municipal Hospital, is that under you? Okay. Rejected NHIA claims of 380,000 Ghana cedis. And the recommendation was the medical superintendent should use a vetting claim report to recover the total amount of the amount is at 3.8 million from the officers whose action and inaction caused the rejection and same paid into the Auditor General's recovery account. Has this been done?
Thank you, Mr. Chairman. No, please. To train the officers in charge of the claims so that the quantum of this recommendation or this response from the district auditor.
Now, excuse me, please. Excuse me, please. Which recommendation? Who gave you that recommendation? The recommendation you just told me.
Yes, so it was in the management letter that was issued to the facility.
So the auditors issued that recommendation in the management letter.
Yes, please.
And isn't that different from this one over here? Auditors.
Yes, please, it's different. And even the amount you quoted, 3 million, there's some inconsistency. The amount at stake is 380,000.
Auditors, could you help us out over here, please?
380,952.
Yes, Honorable Chair, to start from where he ended, the amount actually in the report is 380,952. That is what is in the report. And then I would have to look at the management letter recommendation he's talking about because I don't have it here to really assure myself that that was exactly what was indicated in the management letter. But what we have in the Aegis report is what stands, irrespective of whatever is in the management letter.
Okay. Please turn your microphone on.
Yes, it's on, please.
Auditor, if you look at paragraph 1416.
Honorable Chair, we are looking at Gushegu. Yes. So the caption, when you look at the caption, rejected NHIA claims, the amount is 380,000. And then in the condition, we give the explanation as to how we arrived at the 380,000. So the claim submitted was 3.3 million, and claims approved was 3 million, with a difference of 380,951.53 outstanding.
But paragraph 1416 says You read paragraph 1416.
All right. On which I have seen it. I said, I think that there is an error over there.
Okay.
It's admitted. As I indicated, the recommendation in the AG's report is what they have to implement and not what is in the management letter. Because I said earlier on, no, listen, I said that when you are giving the management letter, you have 30 days to respond. Now, if within the 30 days, you are not able to respond to the issue, or you are unable to provide the remedial action as far as the issue is concerned, then the Auditor General would have to give a recommendation. So in the AG's report, you will see a recommendation that may be different from the management letter. It is because you have failed to comply with what is in the management letter. And so the AG will give another recommendation, and it is what is in the AG's report that must be complied with.
Gwishegu, that management letter that you have, what is the date on the management letter?
Mr. Chairman, the management letter date is 12 September 2024.
12 September 2024. How many years do you have to respond to the management letter?
We have responded to the management letter.
No.
Mr. Chairman.
How many days, months, or years do you have to respond to the management letter? It's in the letter.
Yes, we have 30 days.
You have 30 days.
Yes.
So
Mr.
if you didn't respond to it,
we
it means
responded
gone.
we responded to the management letter, Mr. Chairman.
In 30 days?
Yes, within the 30 days.
Where is the evidence?
That's to the committee.
I'm sorry?
We'll provide that to the committee.
Oh.
Mr. Chairman, we don't have it here.
You don't have it here?
Yes.
But you knew you were going to answer that one. And conveniently, you forgot the evidence. So if you don't respond within the 30 days, the Auditor General will give a recommendation, which will be different from the management letter that he's giving you. You respond within 30 days, then you are home free. Okay, Saboba District Health. Saboba District
Mr.
Health.
Chairman.
Yes, sir.
Please, can I make a remark on the substantive issue?
Go ahead.
The issue has to do with rejected claims, and the reasons that we had were system issue, because some of the over prescriptions that were highlighted, it has to do with the LIMS system that we are using. So for instance, if you give somebody an artesunate, a course of an artesunate for treatment of malaria, that is 24 tablets in it. But when you enter into the system is, considers it as 1. But the prescriber, knowing that the quantity of tablets that the patient is to take is 24. So the system, once you put 24, it bills NHIA as if you have given them 24 tablets. 24 course. That's the blisters. And so it will balloon the figure. But in actual sense, it was only 1 course that was given out. Visit, a patient who is pregnant by the policy of National Health Insurance Scheme is entitled to 6 visits. However, especially some high-risk pregnancies, the doctor may want to see...
6 visits throughout the 9 months of pregnancy?
Yes, please.
Just 6?
Yes, please. That's the policy. And so some high-risk pregnancies, when the patient is near delivery, the doctor may want to see the patient weekly or 2 weeks interval until patient delivers. And so all these visits, we have to submit to health insurance, but they will consider them as what? Multiple ANC visits. And so that service that you have rendered will be rejected
how much of this rejected amount is due to pregnant women going there more than 6 times?
Yeah, so I'm taking the reasons step by step.
You see, we can't just speak in the abstract. It needs to be concrete.
Yes.
But we can all conjure so many other stories. Director General, you need to look into this and find out how many pregnant women are there and making this claim balloon like this.
Chairman, thank you. Medicals you out. Do you know why? You used artisanate to do your example. And you said when they enter one, because it's 24 tablet, it requires 24. Therefore, the ones that the NHIA should have accepted, the rejection should have been more than the accepted claim. Because if one tray of amodiaquine is, say, 20 cedis, and it's entered into the system for 24, multiplied, 23 would have been the rejected. Look at the rejected claims here. They are just about 10%, 8%, 5%. Take your time to explain. Do you understand what I mean? So if immediately you start giving this explanation, it gives away that some of these reasons and the reasons why these things happen cannot be attributed to what you are saying. And therefore, it will be purely negligence.
Director General, this will be part of your assignment. By the way, we are still live, and I wish some of you will see some of the comments that people leave. Is that Saboba District? Yeah. Are you from Saboba District Health Administration?
Yes, Honorable Chair.
Have you taken the oath?
No, please.
Can,
My accountant is a bit under the weather.
Evidence I shall give before this committee.
That the evidence I shall give before this committee
Touching the matter in issue.
Shall
be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
please introduce yourself to the committee.
Director Saboba.
Okay, your infraction is on paragraph 1418, unpresented general counterfoil receipts. What have you done about that so far?
Honorable Chair, they have presented the GCRs and they have been verified. Thank you.
All right, you are discharged. Now, the next group is Nanumba South. Have you taken the oath? Where were you when everybody else was taking the oath?
I should stand now. Yes. So please, you lift the Bible and you may repeat after me.
I, Isaac Asamoah Abeka,
Swear by the Almighty God.
swear by the Almighty God,
That the evidence I
truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
So help me God.
So help me God.
Okay, your infraction is on paragraph 1422. And Honorable Enim would take care.
Thank you, Chair. So this infraction has to do with unpresented payment vouchers. So the auditors noted that 14 payment vouchers amounting to amount of 70,000 from the accountant and same paid into the Auditor General's recoveries account. What has been done so far?
Thank you, Mr. Chairman. All such PVs were duly presented for audit. All were duly presented for audit.
All were
During
or has been? Yes. So was it before or now?
No, at that time.
At that time?
Yes.
It was not at that time. It was after the report was issued. They have presented all the PVs and they have been verified.
Western North, Sefiri also Government Hospital.
Please.
Okay, could you introduce yourself to the committee?
Honorable Chair, my name is Dr. Paulina Clara Pia, the Regional Director of Health Service for Western North.
Please, the name again.
Dr. Paulina Clara Pia.
Yes, the rest of you introduce yourself, please. It's 5 o'clock.
Services, Savia Contombra. My name is Dr. Felix Osesibe, Acting Medical Superintendent at the Government Hospital.
Sefiri also Government Hospital. You have an unearned salary of 3,497. What has happened to it?
Thank you very much, Honorable Chair. Please,
Please.
Honorable Chair, confirmed.
Thank you. The next infraction is on paragraph 1013 and Juaboso Government Hospital.
Yes, it is. Thank you, Madam Chair.
Juaboso Government Hospital, you have an unpaid rent of 29,260. What has happened to that amount?
thank you, Honorable Chair. We've recovered that amount from the staff as well, and the auditors also have that information.
Auditors, could you confirm, please?
Honorable Chair, all amounts have been recovered.
The next one is on paragraph 1016. Honorable Digaf Peito.
There is this a total unearned salary of 53,615.72. However, 4,800 had been recovered, leaving the difference of 48,000. What have you done with it so far?
Please, if you can let me know which district or hospital.
Juaboso Government Hospital.
All right, please, that has also been recovered. Thank you.
Auditors, can you confirm?
Honorable Chair, confirmed.
Confirm.
Madam, Doctor, BBNE Municipal Hospital, payment of unearned salaries to the tune of 110,000 Ghana cedis.
Honorable Chair, we've been able to recover. For the others, we have a payment plan that we are following to recover the rest of the money. Thank you.
So when are you hoping?
So please, For Abigail, she has the land chunk to recover, and we have a plan that makes a pay all by the end of November 2026.
2026 next year.
Yes, that is the
Payment plan
payment
that you've
plan,
agreed.
yes.
Okay. We'll let it go.
All right. The next infractions on paragraph 1022, and Honorable Simon will take care of that one.
Where's it? Sorry, what's the question?
Honorable, I will give you another one.
109.
It's overpayment of salaries resulting from wrongful 908.
It's gone. Go ahead. Please go ahead.
Yes, madam.
Thank you very much, Honorable Chair. So we've been able to recover 13,000 out of the 46,000. So these staff are available and they are working. So we have a payment plan again for them to pay. The payment plan lasts 1 year. After 1 year, to be able to finish paying them the rest of the money. Thank you.
When is the 1 year due? Because we capture all these things and we will play it back to you another time.
Okay. By July 2026. Thank you.
Has a correction been done on the payroll?
Yes, please.
Auditors, could you confirm, please?
Honorable Chair, we would have to confirm that during our subsequent audit with a correction. Yeah.
All right. The next infraction is on paragraph 1026. Madam, over here, no.
Assam Government Hospital, an on-end salary of 24,000. By Fauzia Pelpo Usman Gifty, assuming Mr. Samuel Nkua and Rita Bentel.
Yes, Honorable Chair, we have been able to recover 13,591 out of the amount. Osman has paid, out of the 4,000 for Osman, he's paid 3,490, remaining 570. Rita Bentel has also paid 3,000 out of the 9,612. And Samuel has paid 2,000 out of the 8.
When they are separated staff, we don't accept payment plans. That is more than 3 months, 4 months. And they separated staff. So when do you hope to finish paying this one? Please don't give us 1 year because we won't take it. They are separated staff. Because once they are separated staff, their salaries wouldn't be coming in monthly for you to make.
Intendant to respond to this. Thank
Yes,
you.
please.
Now, the gentleman who just walked in. Hello. Have you taken an oath?
Dr. Ebenezer Nayanzi Ogo, the medical superintendent at ACM Government Hospital.
So share with us, yes.
All right.
Okay, thank you very much, Mr. Chair. We had four staff that were, captured initially we had issue with accepting what the auditors said, their annual leave, based on the plan that we had for the year. Some in the first quarter, some in the second quarter. But behind the scene, we didn't know that they were not going to return. So auditors said they should refund those money because they didn't work for the rest of the year. In addition to, we had to contest the amount that were, captured because they included the tax component, which government had already taken out. So we gave them the status report, which we made available to the auditors, which will not amount to the 24,000 again. So on that note, Osman, for example, without the tax, she's supposed to pay 3,490, and she has paid that. What's the other one? Okay. Then we have Rita Benter. Rita has paid initial payment of 3,000, and just last week added 1,000 cedis to it. And she has given us a payment plan up to December this year to finish paying. Yes. Samuel has paid 2,000 out of 7,261, and is left with 5,261. As for him, we are here to receive the payment plan. We are
new amounts, it will not hold. So I'll ask that you work with the auditors to validate the new amounts, because the new amounts you are saying is once the deductions are cleared, we can finally clear them. So your committee. Once the deductions are cleared, we can finally clear them. So your committee.
Okay. Thank you very much, Madam Chair. We have done same. The auditors were with us 2 weeks ago.
Oh, okay.
They left our office 2 weeks ago, our facility, and we did that reconciliation.
So audit service, please, can you
I don't know if it has gotten to their headquarters. Their headquarters.
Honorable Chair, I have that information that a reconciliation has been done. The tax component has been accounted for, but the payment is where there is a variation. They are indicating 13.
Thank you very much. With this, you can clearly see that they have made, the efforts to clear it. So work with them and make sure the right thing is done. And then please get in touch with Mr. Samuel. Inkua to get you a payment plan, so that hopefully by the end of the year, and this matter is in there. Thank you very much.
The next infraction is on 1029, and Honorable Elekplem will take care of that one.
Thank you, Mr. Chair. So, unsupported payments of 350.
The DSO Government Hospital. You are the, you are still, the regional director. Okay, Madam, go ahead.
Thank you. So, unsupported payment of 352,230. What do you have to say about this amount? Unsupported payments. Thank you.
Thank you very much, Honorable Chair. All right, so it is true, when the auditors came, at that time, the required documentation to be attached was not there. And but now, as we speak, the attached documentation is there, and then we've shown them to the auditors. Thank you.
Can you confirm, auditors, please?
Honorable Chair, confirmed.
All right, Sebastian, there.
Thank you, Chairman. This has to do with unremitted taxes. The amount involved is 5,642, and it relates to services and drugs. The recommendation from the auditors was to this effect, that the medical superintendent should ensure that the withheld tax of 5,642 cedis is paid to GRA and the accountant. Has this been done?
Honorable Chair, yes. The taxes have been paid, and the auditors can verify. Thank you.
Okay, but did you find out what necessitated a delay in doing what is expected of the accountant?
Honorable Chair, at that time, the accountant wasn't well. And I think that's what caused the delay. As you speak now, the accountant is still not well.
Honorable Chair, thank you.
Thank you. The next infraction is on paragraph 1039, and Honorable Cletus will take care of that one. It's on Seshria Contombra Government Hospital.
Same 39,597. Management, can you respond to this? What have you done about it?
Thank you very much. The Akontombra Hospital is a new one. And at that time, there were gaps with the vetting of the claims. But as we're speaking now, we've been able to set up a claims vetting committee, and the claims rejection has reduced from the 30% that we see in this Auditor's General's report to less than 5% as we speak now. Thank you.
The auditors, can you confirm this?
Honorable Chair, we'll do that in our subsequent audit in terms of the committee that has been put in place and then the reduction in those rejections. We'll have to confirm that in our next audit.
Okay, the next infraction is on paragraph 1043, and Honorable Abna Oseasa will take care of that one.
I think that's the last one under the Western North. It's an unearned salary of 123,000 Ghana cedis. And it was to Miss Madam Esther Womeno Florence Jagbele Abe, Eva Jao, Jewu Owusu, John Arthur, and Miss Rebecca Okine to the tune of 123,000 Ghana cedis, saying that we recommend that the district health director should recover the amount with interest at the prevailing Bank of Ghana rate. And these are separated staff as well, unless you have something contrary to what the auditors have written, but they are separated staff. We want to find out what has become of this, whether the monies have been retrieved and paid into government coffers as directed by the Auditor General.
Thank you, Honorable Chair. So for Eva J. Owusu, she has paid all, and we have the receipts, and same have been submitted to the auditors. John Atta had also paid everything. Esther Wemeno has paid 2,000 out of the total of 4 by November 2026.
Okay, so let's capture it. Madam Esther is supposed to finish paying by...
To establish contact with her initially, but with the bond form, we were able to reach the guarantors. And as at last week, she made a payment of 3,000 out of the 63. IOCO is currently following up on the issue, and we are also talking to the guarantors. For Florence Abbey, we've not been able to get in touch with her, but we've reported.
Okay, so the one with the largest amount of 63,000, you don't have any payment plan with her. She's paid just 3,000, and the matter has been referred to IOCO.
Yes, she's not willing to cooperate with us. That once we've reported the issue to IOCO, she would handle everything at the ends of IOCO. So we are collaborating with them to retrieve the amount.
Is she in the country or out of the country?
She's out of the country.
And she prefers to deal with IOCO out of the country?
Yes.
Where is she?
I'm told she's in UK.
Is she? She's a senior enrolled nurse.
Yes.
Okay. So, Minister, if your people can help us, because the nurses who validate other nurses before they are able to move out of the country. We'll be very grateful. As Yoko also seen from the agency under you, because I know they are under you. If you can do that, we'll be very, very grateful. Because 63,000 is quite substantial. I think we are done with Western North.
Yes. We are done with Western North. You are discharged.
And Doc, please keep it up. And I hope that next time we wouldn't have most of these infractions being found in the Auditor General's book under your region. And I wish you all the best, yourself and the team. At least you've been very impressive with how you have retrieved a large amount of your payments. So keep it up. Yes.
Now, let's call Tamale Teaching Hospital. Tamale Teaching Hospital. Have you guys taken the oath yet? Hello? You are live on TV. So,
yes.
Have you taken the oath?
Yes, please.
Okay. What about the others? Okay, now introduce yourself to the committee.
Fine. Let him come here. All right. Yes. My name is Dr. Abubakar Bawa Abdullahi, CEO of Tamale Teaching Hospital.
Abubakar Yaku is my name, Director of Human Resource.
I am Dr. Emmanuel Senakwisi-Donko, Director Administration.
I'm Danla Disaka, Director Finance.
All right, your infraction is on paragraph 1425, and Honorable Kunedu will take care of that one.
Thank you very much, Chairman. Chairman, welcome. Tamale Teaching Hospital. The first infraction has to do with unearned salaries. 1,449,000 Ghana cedis. And the recommendation is that the chief executive should recover these amounts. And if you look at the individuals, you find them on Appendix K of the report. My question is, most of the times, 1 month, 2 months, normal. But when you go through the report, you have 13 months, 22 months, 16 months, 60. Over a year, you are validating people who are actually not coming to work. That is where the seriousness is. You have some of them, the type of separations that we do have. Diseased. That means the person is dead. You have resignation. The person wrote a letter saying, I'm no more working. And we never found this letter and continuously validating the person. A diseased person was validated for 26 months. 26 months. That is over 2 years. Somebody who was dead. And I wonder how that person really was working. So what have you done? Have you been able to recover some of these amounts or all of it?
Yeah, Madam Chair, we were able to recover some amount. In all, we recovered 303,558.68. That's about 21% of the amount we are talking about. We, before we came here, we had gotten letters from some banks that are declining, though they have stopped the transfer to government chest. So maybe at the close of this session, we will make a prayer to this house for the house to make an order directing those banks to transfer. No, we have that, Mr. Chair.
Sir,
like I said, we have written to the banks.
Sir,
they have paid.
Sir, let me ask you something.
Yes.
Look at Habib Napare. Reason, date of separation was 10. And you validated this dead person for 26 months. And you are coming to tell Parliament to do what?
Good. That's okay. We have taken a cue from that, Mr. Chair. 558.68. We have forwarded a total list to Yoko to help us. Yoko has written back demanding for their respective files of persons involved. We have submitted that.
Director, first, have you shown evidence of these recoveries?
Sure.
The 21% to the auditors?
Yes, at the Tamale office, yes, we have done that. Maybe if they can validate that here, please.
When did you submit that to the auditors?
The audit team, we went back and we finished the audit team in Tamale with all these pieces of evidence, please.
The number of letters that you've received, how many of these individuals does it cover? We are looking at over 70 people. Has any of them, those ones, it doesn't become an actual problem because probably the person left in a month, you probably may not see that. But those ones that is the administration also doing to recover these amount? Or is it that those that are alive are not in this country anymore?
Exactly the case, my lord, Madam Chair.
Okay, sure.
Yeah. Yes.
Okay. You see, it seems I just provided you with an answer.
No, there's evidence to that, please. I mean, to this matter, they have written to them, and they made some payments directly to special prosecutor.
They've made some payment. Is
Yes.
it part of the 300,000?
No. We have records of some payments to special prosecutor through us, but they made some payment directly to special prosecutor.
Do you have evidence as to how much has been made through the special prosecutor?
We wrote to them to have update on how much has been retrieved from those people. We haven't had a response yet.
How did you know they've made payments to them?
Sorry?
How did you know that payments have been made to the special prosecutor?
Oh, we called them. We had their contact, we called them, and we were in touch with special prosecutor, the officers who came around. We were in touch with them. They said some have paid. So we formally wrote to special prosecutor to give us updates on how much has been retrieved so far from those category of persons.
When was that letter written to the special prosecutor? You see, it is this year.
Yes, please.
Almost 5 clear months after the audit. And you see the problem. You are very quick to stress on the fact that somebody ought to do the job that you ought to have done. Because you were verifying them. The special prosecutor had no idea. People were dead for 26 months. People had left to resign for 18 months and the rest. And they kept validating them. You kept validating them. It means the HR cares none, head of department cares none. And we end up here telling Yoko and special prosecutor to go after those individuals when you just could have used your pen to cross their names out of a payroll. And that's the problem. So please, verify and reconcile with the special prosecutor to know how much. And don't leave the rest for anybody to do. Try and find them. You know where they are.
That's okay.
And with the banks, it is a duty that you also ought to do. Because if you tell us to give a directive, that one, we'll leave that one to chairman and the committee to decide. But I think it's not right.
That's okay.
Because you are quick so that you can leave yourself out. And we would want the committee to give a directive. That's why we were asked, did anybody attend the funeral of Habib? You did. Gave donation. Even gave his PV, Provident Fund out. And you still came back verifying him.
Thank you.
Mr. Chairman, maybe moving forward, we'll ask you to bring the validators along So they speak to it. Maybe they saw the person's ghost or they saw the person somewhere. That's how come a deceased person will be validated for 26 good months. And then somebody who has worked for more than 3 months, 6 months, running every day to Controller and Accountant General just to be validated. So moving forward, we'll ask that you bring validators who flout these rules. Knowing very well that the person is dead, you validate the person for close to almost how many years? 2 years and over. So, Mr. You come with your validators. Then they will speak to it. Maybe if it's a ghost, if it's someone who is deceased, they saw the person somewhere, sitting somewhere, something we should all take serious. The Auditor General, moving forward, wherever you cite an infraction upon payment of unearned salaries, add to your recommendations that should they not conclude on this before it is put in your reports, they should appear with the validators at the Public Accounts Committee for hearing. Yes, thank you.
The recommendation of the auditors is we recommended that the Chief Executive Officer should recover the amount of 1.4 million with interest at the prevailing Bank of Ghana rate from the separated staff or the next of kin of the deceased staff and pay same into the Auditor General's recoveries account at Bank of Ghana, failing which the Chief Executive Officer and validators should pay. And that's going to be my ruling. The Chief Executive Officer and the validators are going to pay this amount. It's just that simple. Auditors, take note. You see, what worries me over here, management's response. Management did not respond to the observation. They can't be bothered. Ioko, you take care of it. Parliament, you take care of it. Was I the one validating them? So that's my ruling. The next infraction is on paragraph 1429. Honorable Annex Enim would take care of that one.
Thank you, Chair. So this infraction has to do with non-redemption of bond. So the auditors noted that 5 officers who were granted steady leave with pay vacated posts and failed to serve their bond periods as required. The officers were required to refund a total of 350,000. So the recommendation is that the chief executive should recover the salaries of 350,000 with interest at the Bank of Ghana prevailing rates. How much of this has been recovered, Chief Executive?
Mr. Chairman, we have almost recovered all of it. Some of the management, one of the staff was a UDS staff, and UDS medical school staff are recruited from TTH. So one of them...
To make it simple, just state how much has been recovered, not the history around it.
No, I'm thinking that's for those ones. I think apart from the UDS staff, whose the number of months he has served was about 23 months. The rest, we couldn't recover it. And we have also referred same to Yoko, and we are following the guarantors to help us retrieve the monies from them. Many of these people are also not on site.
But can you confirm, I think we have 97,000, 42,000, 34, 89, 86. How much of this has been paid or recovered so far?
These staff, like my CEO indicated earlier, one had served 23 months instead of 24. Then he transitioned to UDS and providing teaching services to our staff. Then one other person, that's Catherine, had served the 36 months, but vacated posts thereafter. So apart from that, the other persons, the other three of the unserved
So you are
still outstanding.
indicating
There are
from
five.
the evidence. Then again, Sumani Hanan was supposed to do 36, which he completed all 36.
No.
How much of?
So we have not retrieved any from these persons as yet.
Okay.
But I'm saying that out of these, 2 of them,
Okay.
more or less, have served the bond.
So
that's Catherine and.
What's the evidence of them serving these bond periods?
Oh, they have been at post actually.
Okay.
For this period.
So when the auditors came,
yes,
were these people at post?
When they came back the last time, this was verified.
Okay.
This was verified.
Okay.
Yes.
So can you confirm if you verified these 2 people?
Yes, Honorable Chair, for the 2, we can confirm that they have served the bond. The Catherine issue was the dilemma because Hassan, it was rather Hassan, who has served 23 months out of the 24. And is now with UDS and 7 over there. So now the issue is whether we should count that as part of the period of 7, the bond. But if that is even taken into account, what we have is that the other 3, they are yet to recover any amount from them.
So what steps have you put in place?
Madam Chair, they form part of the names we ceded to Yoko to follow up on that for us.
Chair.
Look, you see, what is worrying about Tamale Teaching Hospital? That you don't care. Yeah. When you were giving the letter, management letter, what was management's response? Management did not respond to this observation. 350,000. Look, anyway, the 1.4 million, I'm giving you 90 days to pay for it. Auditors know that. 1.4 million. The CEO and the people who did the validation will pay the 1.4 million in 90 days. How much have they collected on this one, on the non-redemption of the bond? We recommended that the chief executive officer should recover the salaries of 350,000 with interest at the Bank of Ghana prevailing rate from the separatist staff and their guarantors and pay same into the Auditor General's recovery account at Bank of Ghana, failing which the chief executive officer should pay. And I will go with the auditor's recommendation. Chief Executive Officer, you are going to pay this amount also. Now let's go to the next infraction. The next infraction is unaccounted staff for 12.9 million. Honorable Duke will take care of that one.
Mr. Chairman, paragraph 1432. Unaccounted staff for 12.962120 cedis, 12,962,120 cedis. This is the findings there. The auditors noted that 129 employees with a total compensation paid of 12,962,119.56 for the period January 22 to April 24th were not at post when a head count was conducted and verification exercised to establish the existence and eligibility of the staff on the hospital's nominal roll and electronic salary payment vouchers in April 2024. So they recommended that two recommendations. The first one, we recommend that the Chief Executive Officer should immediately ensure the termination of these names on the payroll for the amount of 12,962,119.56 as unearned salaries paid to these unknown persons with interest at the prevailing should conduct an investigation to establish how these people were put on the payroll and ensure that punitive measures are taken against the officers who will be found culpable. Mr. Chairman, what is of concern is the management did not respond to this observation.
Clerk, this is a special case that we need to refer to the Tamale Teaching Hospital. 12.9 million Ghana cedis, ghost names. And they didn't care. They didn't respond. Management did not respond to this observation. And you have rather gone to Yoko. Yoko will turn around and then come and investigate you. The next one is on.
Madam Chair, if we can respond to this quickly, please.
Sir.
Yes.
We should have responded within 30 days to the auditors. You didn't respond.
It is true that we responded out of time. That is true. We responded out of
Sir,
time.
if somebody is asking you to pay 12.9 million, I don't know how much you have in your account, and I don't have that in my account as a politician, where everybody will call me corrupt. If somebody is asking me to pay 12.9, and I know that this is not my fault, I'll respond within a day or two. But you did not respond at all.
You can respond to this, yes. Look at this infraction. A detailed review was done, and out of this number, it was established that 29 persons were at post, and they had gone through all the processes that could not be found were made available. So if you look at that infraction, the outstanding figure, it's rather 1,646,77.23, out of which 57,110.62 were recovered. So the outstanding, as we speak right now, is 1,589,664.61. Mr. Chair.
Sir.
Sir.
This is a committee. We do not have the investigators to go into all this. So the Attorney General will be a very good person to investigate you, take you to court. And then when you go, he never did. Sir, let's move on.
Respectfully, Mr. Chair, like I did indicate, these figures I'm talking about, a review has been done with the auditors. So it's not a case that we have not deferred the matter to the auditors to validate. No, please.
The Attorney General will deal with you on that one. Thank you. The next one is unapproved steady leave with pay for 3.7 million Ghana cedis.
Mr. Chair, respectfully, if I may respectfully draw this House back for a moment, if I'm permitted, please.
Yeah, I'm listening to you,
Good,
sir.
thank you. I made a submission on behalf of the facility in respect of this 12 million that is on the table. Respectfully, Mr. Chair, we have not crossed over to validate from the auditors. And I think that this was done, and we invited them, they came for the review, and this is what the records say.
Which one are you talking about?
The third infraction, the 12th.
Because whether it's 1 million or 12 million, you'll be dealing with the Attorney General.
Honorable Chair, so as part of the audit process, a head count was done, and these were persons that did not present themselves for the head count. Now, an observation was issued to them, to come back to us with a response as to whether these individuals actually existed. But at the time, that information was not given. Management letter, the response did not come. The Auditor General's letter came out, and we did not receive a response. Now, the last status report that I had, as at August 8th, indicated that, yes, with the assertions that
August 8th
of this month.
2025?
Last month, yeah, 2025.
Good.
That they came with these assertions that he is making, that some of these staff some of them had actually separated, some of them had gone on transfers and all that. Well, the documents were not made available at the time. But as at the time of 8th August 2025, those assertions were also not backed with documents. But I have received information from the team that did the work and really furnish the committee the status of the issue, because I want to really assure myself that what I'm seeing here is what the situation actually is.
Thank you very much. Yeah, they will get the information, and it will be for the Attorney General, because they didn't respond to the auditors. Now, yes, so he is going to pursue, the Auditor General is going to pursue it. Now, unapproved steady leave with pay, 3.7 million Ghana.
Mr. Chair, with this infraction, steady leave were provided. I mean, they went on steady leave, and the files were put together, and the documentation recovered and placed on them. So they came and had a look at them, and they went. That means that the approval was given before they went to school. Yeah.
You don't pay attention to the auditors anyway. Here, let me read you paragraph 1439. Our review of the personnel records revealed that the management of the hospital allowed 14 officers to proceed on steady leave with pay in 2022 without approval. Management was unable to provide the duration in April 2024. That's 2 years. You were given, when they came there for the audit, after the 3 weeks, they had an exit interview with you, didn't they? They gave you a management letter afterwards, and you had 30 days to respond. What was management's response? Management did not respond to the observation. Now, let me read you the recommendation. We recommended that the chief executive officer should immediately ensure the termination of these names on the payroll and recover the full amount of 3.7 million Ghana cedis as unearned salaries with interest at the prevailing Bank of Ghana rate, and pay same into the Auditor General's recoveries account at Bank of Ghana, failing which the chief executive officer and the validators should pay. I stand by the auditor's recommendation. You are going to pay 3.7 million Ghana cedis. The Auditor General will take care of you. Thank you very much, Tamale Teaching Hospital. You don't respond to auditors. Maybe this is the only thing that is going to shake you so that you respond. You are discharged.
Mr. Chair.
Now, Bono District Hospital, please.
Mr. Chair.
Yes, sir.
I don't know if I have the permission to.
You have the permission to,
Good.
yes.
Thank you very much. Mr. Chair, it is not the case that management teaching hospital do not just care. That is not the case, respectfully.
Did you respond to the auditors?
That is why I indicate, Mr. Chair, that we responded out of time. I must admit. We responded out of time.
Somebody asking you to pay 3.7 million Ghana cedis, and you responded out of time. Yes. You were given about 2 months during the audit, during the exit interview, management letter and you responded out of time. Hey, Masa.
Yeah, Mr. Chair. Respectfully, Mr. Chair.
When they say corruption, it's MPs,
No.
it's politicians. Sir, you are discharged. Let's go to Bongo District, please. It's Upper East Region.
For him to temper justice with mercy, to temper justice with mercy, because it is not the case.
Tamale Teaching Hospital, you are discharged.
Thank you very much.
Now, Upper East Region, Bongo District.
No.
Is Bongo District ready? If not, let's move to another one. What about Presbyterian Primary Health Care, Bolgatanga? Okay, let's call Volta Region. Akachi South Municipal Health Directorate. It's Akachi South here.
Honorable Chair. Honorable Chair. Please, Bongo District Hospital. They have only one issue, so we want to respond to it for them.
Are you the regional director?
No, I'm the director, internal audit.
I'm sorry, you have to wait for your regional director. You have to wait for your regional director. Volta Region, Akachi South, please sit down and let's move on.
Anloga.
236.
Anloga Health. No. Anloga Health Center.
Agotime Zopoi. Zope. Angloga, it looks like you are not ready. Agotime, if you are here, can you sit down? Agotime is not here.
Is the Volta regional director here?
Is your regional director here? Okay, Volta region is not here. Ashanti region.
Honorable, I've not done.
Is the regional director here?
Where is he?
Unfortunately, you will have to make way for the regional director who is here. Ashanti region, do you have your regional director here? Please find your way here and let's finish with them. And then, and please, you have to move for Ashanti to take over. Once your regional director comes, we will call you.
Which group is here? You guys taking the oath? You haven't. Which?
No, they haven't taken the oath. I'm wanting. They haven't taken the oath.
Is this
Ashanti region.
Adanse Asokwa? Is this Adanse Asokwa? All right, please let them take the oath.
Yeah, Adanse Asokwa.
And anybody from Ashanti region who hasn't taken the oath should get up and take the oath with them. No problem. No problem. Let me.
I swear by the Almighty God.
Swear by the Almighty God.
That the evidence I shall give before this committee.
That the evidence I shall give before this committee.
Touching the matter.
Touching the matter.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Is on paragraph 759. And it's an unserved bond of 38,844 in the name of Miss Mani Victoria. What has happened to this amount?
Honorable Chair.
Before you do that, introduce yourself to the committee.
So, Dr. Fred Adumako Boateng, I'm the Regional Director of Health Service, Ashanti Region.
Honorable Chair, I'm John Sapia, the Regional Auditor, Ghana Health Service, Ashanti Region.
David Kunta, Director for Adanse Asokwa.
Honorable Chair, my name is Dr. Jima, Asante Mampong Government Hospital.
Dr. Nyakujekti, Obuasi Government Hospital.
Okay, yours is on
Honorable Chair, yes, the staff in question is currently in the UK, but we have informed Yoko and Ghana Police Service to assist in the recovery of the amount involved.
And what has been the response so far?
Honorable Chair, only last week we went back to Yoko for the update, and they promised they are still in touch with the relatives. And when any recovery is done, they will get us informed.
It looks like, Madam Minister, it looks like your agencies and departments, when they refuse to do what is expected of them, then they all run to Yoko. That's what everybody is doing. And I think, okay, Madam Victoria Mani, does she have guarantors?
Yes, Honorable Chair.
Have you contacted the guarantors?
Yes, please.
And what did they say about it?
Honorable Chair, these guarantors happens to be, we've actually got in touch with them, and they are also making frantic effort to reach the beneficiary. But the report given to us is that the beneficiary is not actually cooperating with them.
Hey, so when these people want to go on a steady leave, we give them forms to fill out with guarantors on them. We don't verify, and then when these people jump ship, then these guarantors wouldn't want to respond. Victoria Money, you said she's in UK, right?
Yes, Honorable Chair.
She's been gone for since August 2023.
That's correct.
Have you reported the guarantors to the police?
Yes, Honorable Chair.
Do you have any record to show that you've reported the case to the police?
Yes, please.
Tender in the evidence, please. And have you given that to the auditors?
Yes, please.
Auditors, could you confirm what he just said?
Honorable Chair, we do not have that evidence.
When did you give those that evidence to the auditors?
Honorable Chair, those documents were forwarded to the Internal Audit Division headquarters for onward submission to the auditors.
My question was when?
That was about 2 weeks ago, Honorable Chair.
Sir.
So,
sir, this happened, this lady, that was when you sent it to your internal, whatever, what was it? Internal
Audit Division headquarters.
To send it to the auditors. But this is not fair to the committee, and it's not fair to the auditors. No sense of urgency over here, because the money is not coming out of your pocket. If this was to come out of your pocket, there would have been a little bit of sense of urgency. Hey, abenkwenpa na yehwe ne senkakre. Auditors, please confirm. Please follow up on the so-called letter that they said they've sent to you. If you find it, do you have a copy of that, what you sent to the auditors?
Yes, Honorable Chair.
You have it here?
Yes, please.
Turn it in to the auditors.
Well noted, sir.
Yes. And Victoria Money, if you are listening to us, which I know you are, come and pay this money. Because we'll be coming after you. You'll be living in London, but you'll be looking behind your back. Just because of 38,000 Ghana cedis. The next infraction is on paragraph 762, unserved bond, and that is Honorable Petu. Is he here? If Petu is, this is Kwadaso. And what has happened? Introduce yourself to the committee.
Honorable Chair, my name is Grace Billy Kampitip, District Director of Health Service, Kwadaso.
Okay, what has happened to this 27,404 unserved bond term?
Please, sir, we have written to the beneficiary, and she has since paid an amount of 7,000 Ghana cedis, and we have had an agreement with her to complete payment within a period of 5 months. She will be completing the payment in January 2026, sir. Thank you.
Good job over there. And Miss Charity Opombekon, you've done well. Keep your head up and pay the rest of the money. The next one is on from St. Louis Health Center. Bojisango.
Honorable Chair, they are part of CHAC.
Oh,
We looked at this, something similar.
okay. Let's go to Confanoche, please. That's my. Confanoche, please. Thank you. Have you taken the oath, sir? Please introduce yourself to the committee.
Honorable Chair, good evening. My name is Dr. Pa Kwesibedu, the CEO of Confanoche Teaching Hospital.
Honorable Simon, that will be yours, please.
My name is Nana Yimaire Abebio, Director of Finance.
Nana, are you a chief?
Yes, please.
Can you give us your title so we address you accordingly?
As I said, I'm Nana Yimaire Abebio. I'm the Twansehine and the Director of
Oh.
Finance.
Nana Onkwaso, what brings you here today?
All right, Nana, you're welcome. Nana, I need your attention. It's unremitted withheld taxes to the tune of 8,634.
Yeah, Honorable Chair, thank you. I think that one has been
Dollars.
dollars. Yes,
So that's a lot of money.
it's been paid and remitted to the GRA.
Auditor, can you confirm? Auditor General, can you confirm?
Honorable Chair, we are yet to receive any evidence to that.
Nana, you just heard him. This doesn't look good.
Yeah, Honorable Chair, it's paid, and the district auditor KMA came to verify it and then gave us a report that they've submitted to headquarters. So maybe headquarters have not received it, but we have it from KMA district auditor.
So if you have the evidence here, the clerk can take it and hand it over to them.
Okay, Honorable Chair, we will do that.
When was it done? When was that done?
Yes. Honorable Chair, most of the PVs were paid, I think, on 20th February 2025 from what we have here. And we have the check numbers, Fidelity Bank check numbers for all the amounts that are to be refunded to...
So can you finish that with the Auditor General?
Overdue salary advances.
Out of the amount stated, we've left about 12,000 to recover, and we've served notice to them, and we've also requested for their provident fund balances from the fund managers. That should it be that by the end of November, if we don't get them, we use their provident fund balances to offset the outstanding balance.
But how sure are you that there's money in their provident fund?
Madam Chair, we do. I mean, we've requested the fund managers to submit their fund balances to us. And looking at the number of years that they've worked with us, we may have enough to recover the outstanding.
So can you give us something definite as to when you are going to clear 35,000?
I'll say that by the end of November, we should be able to clear the outstanding.
So clerk, please take note, end of November for the 35,000. There's also a payment of unearned salary of 3.5 million. Is that it? Yes. Payment of unearned salary.
No, yours is 773.
Yeah. Madam Chair.
No, he's spoken to the overdue salary already. He's spoken to that already, yes. McKinley. Yes, please go ahead.
Madam Chair, thank you. We noticed, in fact, we've categorized mostly 2 and 2024. And we noticed that most of them, so we, under vacation of posts, we've categorized, and most of them were at posts at a time that was, with the exception of, I think, 5 staff amounting to 118,000. Again, for such category, we're using the Provident Fund to do that, recover.
Mr. Chief Executive, it surprises me a bit that the Auditor General comes and says, I have noticed an amount of 3.5 million tune of unearned salary. Then you don't mind the Auditor General. You don't respond to the management query. You do nothing, exit conference, you say nothing, and then you appear before Public Accounts Committee and tell us the amount is wrong and is this. How do you reconcile that?
Madam Chair, we responded to was not Conventional staff at all. So that one was, we will give it to them. We had about 2 staff who just retired in May and April 2024. They were counted for, have taken unearned salary for 2 years. We have 2 staff. One was dismissed in May 2024. One had his appointment or have had unearned salary. We have people that we have released them to Ghana Health Service and Chad. They have released there. We have about 12 or 17 staff that we put them in that category. We have about 9 house officers.
So when you release them to CHAG or Ghana Health Service, they shouldn't be on your payroll?
No, they shouldn't be on our payroll, but for about 3 or 4 months, they still remain
still
on our
on your
payroll until they move to the new agencies. We have house officers who had just ended their housemanship. So basically, they were going to the new agencies. But because they had just left the hospital, they were still there. We had about 9 of them. We made this evidence to the auditors, but they said that they have done the hair count, the people couldn't come and count, so they will come back and they revalidate and see if those people are really not on our payroll. That's what the response they give to the Auditor General. They said they will come back for further actions.
Fair.
Honorable Chair, the assertions that he's making, we are yet to confirm that. When you look at the report, they gave a response, and that is what we have. Now, the status that I have received from the Ashanti region does not indicate that they have provided evidence to the assertions. And so we may have to take a decision on it as to whether we'll have to go back and look at what they have to present.
So your response was that you were going to use the Provident Fund to pay the unearned salaries. And you know that the Auditor General can charge you that failure to do this, the Finance Director, Nana, you have to use your own money to pay for this. So, Nana, respectfully, as soon as you get back, you have to liaise with the Auditor General and the team that came to audit Tamale Teaching Hospital, and make sure you provide them with the relevant documents. Within 30 days, you need to come back and tell us something. Give us concrete evidence of what you have done and the plan you have put in place to make sure you retrieve this money. It's been close to a year.
Very well, Madam Chair. We'll do that as instructed.
Thank you, Mr. Chair. So non-compliance with steady leave requirements. It's amounted to 1,277,254 cedis. Our review of the personal files revealed that 9 officers who granted steady leave with pay failed to serve their bond period. In this regard, the officers were required to refund a total amount of 1,277,253 as salary and then tuition fees paid to them during the steady leave. DJ, any response to this?
Madam Chair, we have written to the, it will not be enough to offset how much they owe the country. And so we now write to the guarantors indicating what the issues are. And so we are engaging the guarantors. And we will take it from there. If we need to seek the help of the security agencies, we will. But we, after the Provident Fund, we've taken that steps to write to the guarantors. So we will recover with your permission.
But, sir, when you look at Dr. David Ebu Bonsra, the steady leave was from 2017 to 2024. Abba. And we spent 685,485 cedis on him. Man, when was he supposed to come back? Not provided. Date of separation, not provided.
Honorable Chair, so this gentleman applied. We are still following up, even though the duration from 2017. And we are informed he's in the UK. We noticed, sorry, I don't have that document here as to the date of sale. Using other sources, sometimes they may have mates to try and locate him, and as well as locating the relatives. So these are some of the challenges we have. But as a hospital, we are using every mechanism at our disposal to trace Dr. Bonsra.
But you gave somebody 7-year steady leave, no paperwork, and you were still paying this. Another one, Miss Amwakohini Yvonne Akoto, midwifery officer, went from 2021 to 2023, and the bond period was 6 years. And you paid a tuition of 24,660, and then salaries of 87,000, a total of 112,000. Since the staff vacated posts, an embargo has been placed. Oh, but how is a woman? They say, hey, it's okay, placed on his provident fund, and his guarantors identified and written to honor every obligation. So these things don't smell good. How much of this have you collected? The 1.2 million.
Honorable Chair, for now, as I indicated, we're going through, written to the banks, and we've written to Old Mutual, that's our Provident Fund. But as we speak now, none has been, retrieved.
Okay. Doc, welcome. Doc, if you look at the third person on the list, that is Miss Margaret Phoebe. Miss Margaret Phoebe. Is it the management response indicates that her file could not be traced? So I'm wondering how, that is what is in the report, page 179. It says her file could not be traced. So I'm wondering how you can go after such a person that a person owes and ought to have served a bond when you don't have a file that is traceable in the organization.
Honorable Chair, I will have to investigate this. Unfortunately,
Sir, you knew you were coming to Public Accounts Committee to answer these questions. And I'm sure you had seen management letter and you had seen this report. And some of these people separated, 2023, date of separation, 2023, and that was 2022, 2022, 2023. Sir, they've been gone for at least 2 years, some of them about 4 years. And we are talking about 1.2 million. Your guys from our Attorney General will be.
Auditors, if you look at the table you've provided, there are about 3 individuals under their tuition fee where 0 is written there. Paid for. It is a matter of salary. It seems like somebody going on steady leave. How then does this person have to come back and serve a bond? Because individuals who go on steady leaves, I'm not sure come back to serve a bond unless those that are actually on scholarships paid for specialization. So if the person's fees were not paid per the table we have here, how do we put there as unserved bond?
Honorable Chair, if you have 0 tuition, what it means is that the probability or the possibility is you may have gotten a scholarship. And so with that one, when we are asking for a refund, that will be taken out. But then the salaries that you received whilst on steady leave is what we will require from you. Because government continue to pay you whilst on steady leave. And so the bond is that you should come back and come and serve the nation after you are done with your education. So that is how it works.
Does it mean that all individuals who go on steady leave are required to come back and serve a bond? Or those individuals who are given scholarships for specialized training are those ones that are bonded?
Once you sign the bond form, you are supposed to come back. You may have gotten a scholarship, but once government is paying your monthly salary whilst you are away, you would have to come back and serve the nation. And that is what a bond form that you have signed to indicate, and you must come back.
Take care of that one.
Thank you, Chairman. Chairman, notice. And the amount involved is 26,952, 52 Ghana cedis. CEO or management, can you respond?
Honorable Chairman, yeah, it's true. But I think 3 of them have paid to use the balance on their provident fund to pay off any salary that they took in lieu of notice.
Have you done any recoveries?
Yes, I said that 2 of them, Vida Banabo and then one other person have they have paid their portion.
You have any proof? Can the auditors confirm this?
Yes, honorable member. We give the information. As I said, we give all this information to the Kumasi District Office for this, which they have come to verify, and it's in their report that they gave us a copy, that they will forward to the headquarters for them to submit. So I think maybe...
Service in Kumasi gave to you. Do you have a copy here?
Yes, madam. Unfortunately, I had a soft copy that I can forward to them. That is habit from their office.
Okay, so the clerk will take it and then forward it to them. Thank you.
Yes, please.
Well, I'm done. I think I wanted the auditors to confirm, but if they cannot confirm it, maybe they can do the reconciliation later.
No, Honorable Chair, I can confirm that there have been the recoveries that he mentioned. What we will have to reconcile is that we are having a total of 11,000 to have been recovered. So we have to do a reconciliation with them.
Thank you, Chairman. I think I'm done. Except to add that, Chairman, the auditors or the management, senior managers should realize that they should not allow junior officers to put them into this kind of supervision of your subordinates, so that these things doesn't come up to you, or you are the ones that comes to answer. So you need to really be on them. If you give a job to your subordinates, you should ensure that the right thing is done. You are doctors, health professionals, diligent workers. So you don't come around this platform and the infractions are too many, and the explanation is not forthcoming. It doesn't augur well. I can see DG not being happy. Minister is not happy. Everybody is not happy around this platform.
The next infraction is on paragraph 7A6. Staff unaccounted for.
The Auditor General says they noted that when they came for staff audits, 101 staff in your hospital on your payroll could not be accounted for. They conducted this first one in April 2024, and then they followed up in September 2024. The auditors are saying these officers were paid 15,821,000 Ghana cedis as salaries during the period, from the period of January 2022 to April 2024. And they were not able to establish the legitimacy of these staff. And they've asked that, one, it should be recovered, and two, the Chief Executive Officer and the validators should pay if we are not able to recover. That is why I said that moving forward, if you are cited for any infraction that boils down to validation, the validator will have to come with you to come and answer why they validated people who do not exist on their payroll. So, Chief Executive, please, that according to the Auditor General, are not supposed to be part of your establishment because they did not...
Said earlier that out of these, we categorize them. One, who is not a Tamale Teaching Hospital staff, two retired. And
this is not the same as the previous one. They are two different things. And you are not supposed to put them together because they are two different audit infractions. If you had wanted to do that, you should have done where you want to. Now it's out of your hands. They are saying that 101 staff, and this is different from the previous infraction that you were cited for. So speak to the 15.8 million that you paid to staff who do not work at your outfit, according to the Auditor General.
Yes, Madam Chair, thank you so much. We indicated, in fact, when they came, most of them were at posts. I think in April, and then the second one. So we invited them again as management. That was, I think, somewhere in April or so for reconciliation.
April, when? Which year in April?
I think this year.
The auditor said they came in April 2024 and September 2024. So truly, if they were at posts and they missed the first one, why were they not there for the second one? Truly, if they are real human beings who, work with the Tamale Teaching Hospital, and you have heard that they came for the first audit, they were not part, and they are coming for a second audit, a validation of the first one, and you still don't want to be part. It's because you keep validating them. It's because they don't mind, because whatever it is, whether they come or they don't.
Clerk,
Those going to AG.
do us a favor and add it to the Attorney General. And then prosecute Konfanochi Teaching Hospital. 15.8 million Ghana cedis. Of an end salary, ghost names. They came in April. And then you argued with them. Management responsibility, they realized that most of the staff were at post, but were on various types of leave, such as annual leave, study leave, leave without pay, sick. They came back in September, and 101 of the staffers on the payroll were not available. I'm sure you have enough evidence for the Attorney General. Clerk, add them to it. Attorney General will love that one. The next infraction is on paragraph 791, Madam.
Missing payment monitors. Yeah, missing patient monitors. That is what the infraction states here. That contrary to proper system controls, and they noted that during the verification of assets, assets of 2 sets of patient monitors costing 84 million, which 84,000 Ghana cedis, which was assigned to the Pediatric Intensive Care Unit, PICU, could not be traced. And they are recommending that the Chief Executive Officer recover the current monitors. If not, they should replace it.
Madam Chair, thanks. Thank you so much. In fact, I think it was captured in error. The reason being that the award for provision of those monitors was issued on the 14th.
This is a bit noisy. There's someone.
It was supplied. In fact, we have the job card, where the job card, when they go for it from stores to the units, and that was on the 4th of April 2025. So we followed up and noticed that it was captured in error. In fact, the cost.
So, Mr. CEO, was this part of your management report? Was this in the management report?
Yeah, Madam Chair, it was part of, we explained to the auditors that that data, which was in the asset register, was an error. We had noticed that. Usually,
so it was part of the management report?
So we explained, but the auditors' reason was that since it was in our asset register, they are not going to take it off. But we had noticed that it was captured in error. Because after the
so you captured it in error?
In our asset register.
In your asset register?
Yes.
In error?
Yes.
And then the auditors come, they say, let me see what you have captured in your own assets register.
Yes, madam.
And it was then that you realized that you had captured it in error.
No, madam, we national servicemen, and then we have our quality assurance, so that goes over to validate what they have captured. During the validation, we realized that it was by asset register, so they can't take it off. And we showed them evidence that though the request from the department was made somewhere in 2023, it was not procured until 2025. So it couldn't have been an asset as part of property in the hospital in 2020.
Handles your asset management register?
No, we have an office that manages our fixed assets register.
So who in particular does it? Who in particular does the entry?
Yeah, in the office.
Madam Chair, he has been seconded to one of the agencies, I think this year.
Someone does something in error, you need to apply the sanctions. All you do is second the person. What if the person goes there and does the same thing?
He's with the Gaming Commission, and that is beyond the hospital.
He's with?
I think the Gaming Commission, the officer who was there at that time.
But you just told us that the person had been seconded. I did not say that. And someone from Konfanochi to Gaming Commission is not secondment. You're under oath, Mr. CEO.
Yes,
Dr. CEO.
Yeah, madam, he was given an appointment to go work at the Gaming Commission this year. And because he was leaving our payroll but not leaving the system, he applied for us to that he'll be on secondment so that he'll be off our payroll and be at the Gaming Commission. But he was given appointment. He's on appointment now.
So is he on your payroll or he's not on your payroll?
He's not on our payroll now.
You've taken him completely off your payroll.
Yes, madam.
Auditor General, notes this, ask for the name of this officer. Note it and check in your next audit to see whether this particular person is still on the payroll of Tamale Teaching Hospital. Because it's very, very important. In one breath, they say the person is being seconded. In another breath, they are saying something else. But respectfully, I still will not take it, just like the auditor said. You yourself entered the entry, made that entry into your assets register. And now they come and they say, let me see, show to me these monitors. And you are saying that it was entered in error. So currently, what has happened to it? Do you now have the monitors or not? And if you have it, have you called the auditing team to come and verify that clearly you have now purchased it or not? Can you tell us something?
Yes, Madam Chair, we currently 472 cities and 16 pesos, as against the 42,000 they indicated in the audit report.
So the 42,000, who put it in there? Was it the person who entered the monitors in the assets register, or it was the auditors who gave it a value? Come by the value of 84,000 as the cost of 2 monitors. In the assets register, what was the value?
Madam Chair, as we indicated, this was an error.
It was an error entered in the assets register. So in the assets register, with the error that you are talking about, what was the value?
Madam Chair, as I have been informed, in the assets register, a value of 42,000 was entered.
Interesting, isn't it? 1 monitor. The Auditor General asked for verification. We are told it was entered in error. Now they go to buy it, and 1 monitor, buy how many monitors? 4 good monitors, and you still have some change.
GTV, the authentic and trusted voice of Ghana.
Ready to rock and roll this beautiful Monday. It's a blues night, so let's make some money to start the week.
And that day, Delta Tuesday live drone ADF Ajomansa Hall, and I did me join your Facebook, YouTube, Sansuna GTV.
All right, so another night to make some money without wasting much time. I'll just take.
Alpha Lotto Company Limited is a business registered under the Registrar General's Department and is also licensed under the National Lottery Authority to operate legally within the confines of its mandate as a private lotto operation business. The Ajomansa Hall doors are open to the general public at exactly 8. Live audience is completely open to the public so that anyone with an interest can join and also participate in the draw itself. To the public, the same applies to the high table. Each commissioner is randomly selected to scrutinize closely the entire process and given a document to record the outcome. Before each day's draw, the draw masters and lotto officials bring in the balls for inspection in the full glare of viewers and the public. Prior to the live telecast, the director inspects the proper position of each number before the inspection by the commissioner.
We'll call on the high table to do the inspection of the 1 to 90 balls. Put your hands together for the big man himself, Prof. Eight 105 and Takwa